Thank you. Hello, everyone. I'm Guillaume Bernard from LNE, which stands for National Laboratory of Metrology and Testing in France. I would like, so to give you a little context, myself, I'm a research engineer in AI, mostly project manager, both on a technical level and more on high level for both European project or contracts that we have with industrial private companies. And I'm also a lot involved in the process of regulation of AI system and their certification. Meaning, and finally, also at LNE in my team, I'm the one that is mostly working on healthcare projects with AI. So really, the perfect scope for this meeting today. What I would like to share today is our little past experience that we have dealing with private companies that want to get obtain the regulation for AI systems. So, as you may know, for now, in healthcare, AI medical device are classified as high-risk system where they are class 2A or class 2B or class 3, meaning it's a kind of classification that we have in the other main regulation in healthcare, the MDR, medical device regulation. Meaning that for those private companies that are trying to sell their systems, their AI systems, their medical device with AI on the European market, they need to both answer the requirement of the MDR and now also we need to answer the requirements of the AI Act in the summer of 2026. At least that normally the main the date. So at LNE, we are trying to help such SMEs with understanding what the AI Act requires of them, especially compared to the MDR. Meaning, okay, you already had some kind of requirements you had to answer in regards of data, for instance, when you want to validate your medical device before selling it on the European market. What does it mean in terms of similar requirements from the AI Act? Meaning that we generally when a private company contacts us, we begin to explain them that we have two main approach to help them. First, we can I would say looked at their process in development, evaluation, conception of their AI system, see how they are mature enough, and also how they answer the requirements of AI. For instance, does they have the correct level of transparency? Did they ensure that their data correctly represent all of the markets they want to aim? For instance, if did they have enough samples from different type of population, whatever the age, the sex, and so on, but also other type of features that we have in the data, and so on. And the other type of how we try to help these SMEs is by evaluating their system. So, as you may know, in AI, not only in healthcare, the testing of AI system can be quite a hard task because AI systems are a black box, and it's harder and harder since the systems are getting more complex every month and every year. So when we test the system, we have to look at the data that we have in the input of the system and the output of the system to try to understand the behavior of the system and to ensure the correct level of performance. And it's one of the main requirements of AI Act is to ensure a correct level of evaluation and testing. To give you a quick example, and then I will finish. We recently helped a French SMEs, which is called Median Technology, which developed an AI system that aims to detect if there are cancerous nodules or tumors, if you want, in the lungs of a patient. So they have a system with actually 4 AI functionalities, which when they detect the lungs and they detect the cancerous tumors, and then they characterize the gravity or the malignancy of the tumors. And we help them by assessing the maturity of their process And then, moving on the second phase, we test ourselves using the evaluation data, their systems to assess their performance. We compare them with their own internal testing because most of the SMEs will already have their own internal testing, and we help them to identify which part already answer all of the requirements in AI Act and also in regards to MDR, and which part needed to be strengthened in order to be able to reach compliance to the regulation. And since then, they are currently in the process of reaching to obtain compliance first for the MDR regulation, but with the work that we have done, they will be ready in 2026 when they want to obtain the regulation. So one of the last points that I wanted to talk about, and then I will be finished, is specifically for the healthcare domain. We heard a lot of the amount of regulation that AI providers needs to answer in order to sell the market for the open. There's a lot of discussion around that. The good point is that for the healthcare domain, the requirement that is already asked of medical device providers with the MDR make that they are already mostly ready to answer most of the AI Act, not all, obviously, but a lot of the answer requirements of the AI Act because there is the same requirements in terms of transparency, testing, the quality of data, and so on. So, yeah, that's all I wanted to say today. Thank you.